Cervical disc replacement recovery is actually quite fast compared to fusion. The reason is artificial disc replacements in the cervical spine heal in quite quickly. At 3 to 4 weeks, I will start you back in physical therapy. You can return to work in a few days if you want, if you're not a heavy laborer. I actually, when I had my cervical disc replacement, I came to work the next day. I had a little sore throat and it was a little achy in the neck. So when you're recovering from artificial disc replacement, one of the things people complain of or feel is they're achy through the back of the neck and shoulders. This is the most common complaint because when we place the artificial disc, we raise the space back up to the old disc height. That causes some ligament stretching. That discomfort usually fades between 2 and 3 weeks, sometimes 4. But it takes 3 to 4 weeks for the disc to seal into the bone. So when the soft tissues of the neck heal and the bone is integrating into the disc, we start your physical therapy and exercise 3 to 4 weeks after. And with a really good therapist, you make a very fast full recovery in 2 to 3 months. You're back in action.